With Mr. Psora, there's lots of ideas, lots of things in his head, but unfortunately he doesn't have the practicality. He cannot convert that into practical reality. So lots of ideas, but lack of practical sense to a certain extent, like your sulfur. Lots of ideas in the head, very theoretical, but unfortunately cannot make practical use of what he has. You go to Mr. Psora's house, you have 100 books in his library. Have you read all of them? No, just the first page. Because he has that superficiality. Yeah, no, I have lots of books, but have you gone into the depth of any of that? Not really. Full of impractical ideas, again, lack of depth. Always superficial, theoretical person, lack of practical sense. Psora, my friends, is low on energy. So again the hypo comes here, you see. Low on energy levels are low, very easily fatigued. So that low energy is manifested either by being fatigued very easily, weak very easily, or they are very lazy, don't like to move about, always on the couch, they don't like to be very active. So hypo energy, very quickly fatigued, and very, very lazy, and that's the Psoric low energy as well. Untidiness, again what you have seen in sulfur, Psorinum, very untidy, don't like to have a bath. That is another Psoric sense, Psoric criteria. Lack of sense of tidiness. Could be due to laziness, could be due to low energy as well, that they are totally untidy. Now this is important because many times you will find certain symptoms mentioned in both the miasms, but you have to understand here that hopelessness to start with is Psora. Lack of hope, lack of positive thoughts, hopelessness to start with is Psora. But again, you have to consider this in the timeline of the patient's life. That has continued, that hopelessness, it has been untouched, untreated, no medication, no treatment. It's continued, deepen. 5 years down the line, you meet him, the Psoric hopelessness has transformed into a syphilitic hopelessness. 2020, he was telling you, I'm low on energy, I feel pessimistic, I feel hopeless, little bit. 2025, you meet him, he's telling you, I don't see any light at the end of the tunnel, it's all dark. I feel my life is completely surrounded by darkness. So that hopelessness has deepened, that hopelessness has progressed. And there you have a syphilitic hopelessness. So hopelessness to start with is Psora. But again, you have to understand when it has progressed, when it has deepened, that's when syphilis turns in. When it doesn't see any light at the end of the tunnel, and that hopelessness is now intermingled with suicidal thoughts, that's when syphilis turns in. So don't be bewildered that a particular symptom is under both the miasms. Yes?
So could you see, say, someone starts with Psora and then they combine, or when they're coming out to getting worse, it goes through these different...
Can go in phases.
Yeah.
Like it started with a Psoric Psoric is generally the starting point, yeah, because when you are starting, yeah, but gradually as say for example with the hopelessness, it started off with Psora. When you're depressed, it started off as a superficial, or I won't say superficial, light hopelessness. That has progressed over time and that has deepened. Many exciting causes have come, and then it gradually progresses to a syphilitic state.
And then when you redress it, you get that syphilis.
Not really. Many times, if you are starting with a syphilitic remedy, it gets cleared all at once.
Yeah.
No. It may follow like that as well, what you are saying, but it can go completely off with the indicated remedy as well. Now, my friends, fears. When you have lots of fears, that's always a Psoric manifestation. Fear. You ask the patient, what are you afraid of? Oh, I'm fearful of everything. You name it, I'm afraid of it. Do remember, you have to think of a Psoric remedy in such case, especially if you are stuck. So, fear of darkness, fear of heights, fear of thunderstorm, you name it, they have the fears. Farrington mentions this in his clinical Metromedica. When you come across a constitution who is fearful to everything, always think of Calcaria. Calcaria is the most fearful of the remedies, who has fear of almost anything and everything under the sun. So remedy-wise, Farrington mentions Calcaria, but miasmatically, do always remember Psora is there at the background. So lots of fears, shyness, timidity is there. Again, to a certain extent, there is lack of courage in that. We'll talk about timidity in psychosis as well to a certain extent when we come to that. But many times, the shyness where courage is less, where they're cowards, unable to speak, that's more like a Psoric manifestation. Three A's of Psora, I shared this with you earlier: anxiety, alertness, apprehension. And here alertness is not in a positive way that you're very alert and active, but here you're always on the edge, like, whatever I hear a news, what if the phone rings and I hear something? So it's always on the edge, that kind of alert in a negative way for the Psoric miasm. Anxiety, alert, apprehensive. Now again, another word where you find in both two miasms, in fact, here, restlessness. My friends, mental restlessness is Psora. So it's always in the head, it's going on, what's going to happen, what's in the future, how I'm going to manage my finances, what's going to my health. So mental restlessness is Psoric. Like what you have with aconite. It's always going on in the head. Anxiety, fear of death, worry. But when it's physical restlessness, a physical hyperactivity, that is psychosis. So physical restlessness, physical hyperactivity is psychosis. Whereas in the mental restlessness, which is intermingled again with anxieties, intermingled again with fears, that is Psora, Psora, and Psora. So see the fearful, anxious, apprehensive aspect. Whenever you come across, do think of the Psoric predominant miasm.
Sorry.
Yeah.
Could the physical restlessness, could it be tubercular?
Tubercular?
Yeah.
To a certain extent, I will come to that, yes, because sometimes it's due to that changeable mentality. Sometimes they are so bored that physical restlessness can come in. But to start with, psychosis generally. Fears, you see again, school-going fears, fears of disease, fear of failure, that lack of courage to face any situation. That is one of the trademarks of the Psoric miasm. The inability to face difficult propositions. Going to school is a difficult proposition for a teenager, for a school-going kid, and that fear is Psoric. Anxious, nervous, fearful. You see here, this is where you get a combination of miasms. Think of Argentum nitricum, gelsemium. These are remedies where you have nervous diarrhea. Right? Argentum nitricum, gelsemium, you have nervous diarrhea. Whenever they get agitated, you get an urge for stool. If you consider diarrhea as a miasm, psychotic. Fluidy stool, lot of intestinal movement. We'll come to the bowels later on. But diarrhea miasmatically is psychosis. But if you look at the background of it, why the diarrhea has developed, it's not due to food. It's here. That's why the diarrhea has developed. He's anxious, he's apprehensive. So that anxious, apprehensive, Psoric mind is resulting in diarrhea. So here the manifestation of a nervous diarrhea is psychosoric or Psora psychosis. So a combination of miasms where there is the anxiety, the nervous aspect, but at the same time the manifestation is a psychotic miasm manifestation. Again you see introvert. To start with is Psora. I don't like to meet many people. I'm rather be better by myself. And that has progressed. That has not been taken care of through medication, through counseling. That has not been taken care of. Progress. It goes to a certain point where you don't want to get out of the room. You don't want to meet your parents even. Meet your partner. Just shut the entire world on your face. So that introversion goes to syphilis. So introvertedness, to start with again my friends, is Psora. But you have to understand where syphilis comes in. It's when it has progressed, it's when it has deepened, that you have completely, the intensity has increased. You understand what I mean? Where I was not willing to go to social gatherings 5 years back, now I'm not willing to meet people in my house even. That degree of shutting up, that's where it has come from a Psoric introvertedness to a syphilitic introvertedness. So hypo, lack of contact, to start with again is Psora. So what you got for Psoric mind? Quick recap. 3 A's: anxiety, alertness, apprehension. lots of fears under the sun, all from a school going fear in a child to a cancer fear in an elderly. So all kinds of fears. Shy nature, introverted, hopelessness, to start with is Psora. Timid nature, to start with is Psora. Untidy, why? Either due to laziness or due to lack of energy, Psora. But a very superficial person who doesn't have the depth, who doesn't have the practicality to go into deeper of everything, and that is your soul.
So
Come,
if
yeah.
you had a patient with all of those fears, but they were very tidy, you wouldn't consider them.
Not really.
disorder.
You have to look at the entire picture. Which is the predominant miasm coming up. So when you did do the evaluation and you got 12 symptoms and you find 7 or 8 of these is under the psoric miasm, so your predominant miasm is Psora. Because where you have done a case, you'll see amongst the 12 or 13 you have taken, there may be 1 or 2 syphilitic symptoms, 1 or 2 psychotic symptoms, but it's always a surface miasm. What is on the surface? It's a very valid question. So whatever is on the surface, what is the predominant manifestation? Go ahead with that. So 1 or 2 symptoms may not corroborate with that.
The diagnosis will not diagnosis. Suppose patient has hypothyroidism, gallstones.
You have to definitely incorporate that. That is the presenting manifestation. Definitely, yes. And make a combination on what is the major physical complaint for which he is consulting. Patient has come to you for a uterine fibroid tumor. There is psychosis there. Now you see the entire picture if there is more psychosis, and then that will always help you to come to a better prescription that way. But definitely incorporate the predominant pathology.